cold and cough? Is it normal or low immunity? This is a common question in my OPD practice. Normal children can get 6 to 10 episodes of cold and cough in a year. These are mostly viral in origin, and commonly they are seen in the first year of schooling or first year of daycare admission. So, if your child is growing well, not having fever, looking active, not needing oxygen support, something which is not worrisome, and it could be part of the maturing immune system and is normal. But if your child is having repeated episodes of fever, cough associated with sputum, rapid breathing, dip in oxygen saturation, needing hospitalization or intravenous antibiotics, it's a sign that something beyond a normal viral infection and needs evaluation. It could be a problem of low immunity. So it's important to differentiate between normal immunity and low immunity and further decide on investigations. Thank you.